My name is Otto Scheck, and I am a third-year radiology resident at Einstein Healthcare Network in Philadelphia, Pennsylvania. I have the pleasure of presenting a case of an ingested button battery. Our patient is an 11-month-old female with fussiness and worsening drooling for 3 days. Frontal radiograph of the chest obtained at presentation shows a round radiopaque foreign body measuring 2.1 centimeters in the cervical esophagus, demonstrating a beveled edge, known as the double ring sign, indicated by the black and yellow arrows. There are tiny erosions along the inferior edge of the foreign body, indicated by the blue arrow. The foreign body is aligned in the coronal plane, meaning it is en face on this frontal projection. The lungs are clear. Lateral radiograph of the neck at presentation shows a radiopaque foreign body demonstrating a step-off, indicated by the blue arrow, in the cervical esophagus at the level of the cricopharyngeal muscle, with retropharyngeal soft tissue swelling and associated deviation of the trachea, indicated by the yellow arrow anteriorly. The imaging findings are consistent with button battery ingestion. To review, the button battery is lodged in the cervical esophagus and demonstrates two specific signs, the step-off sign and inner rim sign. The location, at the level of the cricopharyngeal muscle, is a common site of obstruction. Remember, the cricopharyngeal muscle is at or near the C5-C6 level, as seen on the lateral radiograph. On the lateral radiograph, the button battery is clearly not in the airway. The retropharyngeal soft tissue swelling with displacement of the trachea anteriorly is concerning for corrosive injury. Tiny erosions along the inferior edge of the battery, as seen on the frontal projection, are also concerning. The differential diagnosis includes coin ingestion, but remember, coins have a different morphology and appearance compared to button batteries on X-rays. The step-off sign on the lateral radiograph is specific for button batteries and not coins. When seen en face on a frontal radiograph, coins do not demonstrate an inner ring. It's important to differentiate between an ingested button battery and coin, as an ingested button battery may cause severe corrosive injury and is considered an emergency. To summarize, cervical esophageal button battery impaction usually occurs at the level of the cricopharyngeal muscle, where the diameter of the esophagus is most narrow. Classically, the battery will demonstrate a beveled edge en face and a step-off sign in profile. Look specifically for soft tissue edema or irregularity along the edge of the battery, which are concerning signs for corrosive injury. Button batteries are particularly dangerous because leakage of their alkaline corrosive agents may cause perforation, fistulization, and even systemic toxicity within hours of ingestion. Importantly, intrathoracic location can lead to dreaded aortoenteric fistula formation. And with that, I hope you enjoyed this presentation. Thank you for watching.